Hi, good afternoon, everyone. It's good to see you all. I'm Emily Beauregard. I'm the director of Kentucky Voices for Health and a member of the Thrive Kentucky campaign. And this is our monthly state and federal policy update. I have to tell you, April absolutely snuck up on me. Probably a lot of you, if you were, kind of in the throes of the legislative session in Frankfurt, but I am not upset about it. I'm so glad we're in the middle of veto days. Really good to have a break, some time to just decompress and think about what our next steps are going to be as far as advocating on some legislation. And we'll be talking a little bit more about that today. But also wanted to say thank you to everybody who has, over the past month or two, signed on to letters, either in support of bills or opposing bills. Came to Frankfurt to testify or to speak at a press conference, meet with legislators, made phone calls, sent emails, you name it. We really, really appreciate everyone lifting up their voices and making sure that our legislators and policymakers know what we need for good health and well-being in Kentucky. So appreciate everyone who's been involved. As I think most of you know by now, these are our monthly meetings where we want to make sure that you get the latest information on the state response to COVID-19, get updates on safety net programs, share feedback, ask questions. So we'll be doing that today. Kelly, why don't we move forward to the next slide? I know most of you are familiar with Thrive Kentucky by now, but for anyone who's joining for the first time, our core purpose is to meet the basic needs of every Kentuckian through systemic change. And that's because we recognize that many of our fellow Kentuckians have faced historical and systemic barriers to meeting basic needs. And for that reason, the work that we do together as Thrive Kentucky focuses on anti-racist and anti-poverty policies that can lead to a more equitable and just Commonwealth for all Kentuckians. You can see the shared principles that we follow on this slide. And if you'll click to the next, these are the members of Thrive Kentucky. And many of the people speaking today represent one of those organizations. Also want to give a big shout out to our sponsors for the 2022 Advocacy Series. Thank you very much to United Healthcare, Anthem, Passport, and Humana, Healthy Horizons for sponsoring these webinars. It helps us to keep these free and also to offer CEUs for certified community health workers and licensed social workers. So thank you very much. And if any companies or organizations are on today who want to consider sponsorship, feel free to reach out to Kelly. We continue doing that on a rolling basis. Let's go to the next slide. Here's the agenda that we'll be covering today. Each section, feel free to put your comments or questions in the chat. We prefer to just address those as we go. And if we don't have time to get to everything, in the next 90 minutes, we will make sure to send a follow-up with answers and with information that's been requested in the chat. But we usually have a lot of people who are kind of monitoring, and we'll make sure you get the information that you're looking for. And we also appreciate your feedback and information that you may have to share with us. So don't hold back. What else? Just some quick housekeeping before we get started. As always, we have a lot of folks on the phone today, so please keep your line muted. We are recording this webinar. We'll send out a link to the recording along with the slide deck and any other materials that are shared today, the chat. We'll send all of that out along with an evaluation tomorrow. So you can watch for that in your email. And I mentioned, CEUs for certified community health workers and for licensed social workers. And if that's you and you'd like to get CEUs, you can reach out to Kelly and she'll make sure to help you get that done. And with that, I'm going to turn it over to Dr. Sheila Schuster to give us an update on the 2022 General Assembly.
Thank you very much, Emily, and good afternoon to you all. I just want to echo what Emily said as we go through our good bills that are bad to awful bills. You all did a tremendous amount of work and some very good work on your advocacy during this session. We've got 2 more days coming up, and so we want to talk about what's still hanging fire, if you will. Kelly, if you'd go to the next slide, please. So just to tell you where we are in the session, remember we're in a 60-day session, which is the long session, and the legislators have recessed since last Wednesday. They were in on Tuesday and Wednesday. They will be out through April 12th for the veto days. The governor by constitution has 10 veto days. That's not counting Sundays, but it is counting Saturdays. To give him an opportunity to do one of 3 things. He can either sign a bill into law, he can express his displeasure that falls short of vetoing by letting a bill become law without his signature, or he can veto a bill. And with the budget bill, he could line item certain lines in that particular bill. The other ones, he has to either veto the entire bill or not. Then the legislature will return on April 13th and 14th. I think I mentioned in earlier webinars that we're ending the session a day early because April 15th is Good Friday. And so they've moved the calendar up a day. We still have the same number of legislative days, but they will be back in on the 13th and 14th for their final actions of the session. They have to adjourn by midnight on April 14th. Before the days of computers, they used to physically stop the clock and continue to do work past midnight, but now with computers, they can't do that. So they will consider each of the governor's vetoes and will probably take action to decide either to let the veto stand or to take action to override the veto. The override is actually fairly simple. It's a simple majority vote of both the House, that would be 51 votes. That's what they call a constitutional majority. And the Senate would be 30 votes in the Senate. So even if it's a majority of those present, it doesn't constitute a constitutional majority. So they have to have 51 votes in the House, 30 votes in the Senate to override. They will also probably pass some additional bills on those 2 days, but they are bills that they're pretty sure that the governor will not veto, or I guess they figure if they pass them and he vetoes them, that's okay with them. They will not have an opportunity to override those vetoes because when the session ends, it ends sine die, which means without another day, and it will end at midnight on April 14th until the first Tuesday after the first Monday in January, unless we have a special session. So next slide, please, Kelly. So we have a couple of good news bills. I tried to do a kind of color coding so you could follow. The green ones are bills that have passed both the House and the Senate and either have been signed by the governor or are over on his desk to be signed. The bills that are in orange, the yellow didn't show up very well, are kind of bills that are still hanging fire. They still could be passed. They're still out there in the session. And then bills in red are bills that are dead for the session. So House Bill 1 is the budget bill. It does keep Medicaid and SEEK funding intact, and it does address the pension costs for the quasi-governmental agencies. Those are the community mental health centers, public health departments, the rape crisis centers, domestic violence shelters, and the children's advocacy centers. It does include significant pay raises for state workers, but none for teachers. And that is a source of great controversy. There was some recent publication of Mississippi, which is the state that we so often are compared with in terms of being poor southern states, and they just put in a significant raise for their teachers. I think the legislators would argue that they gave some additional money to each school district, and they're going to let the individual school districts decide what they want to do about reinforcing their teachers. House Bill 44 was a good news mental health bill. It was watered down a little bit in the Senate, but it still is good news. This was brought by a couple of local high school students, one in Jefferson County and one in, I think, Laurel County, who went to their legislators and said, we need to be able to have an excused absence. I think we just went back, Kelly, to the wrong slide. We need to have an excused absence for a mental health reason. What happened to our?
I'll pull the slides up.
Okay, thank you. Because I don't have them memorized. So in the Senate changed that bill, unfortunately, and is leaving it up to the discretion of each of the local school districts instead of making it required across school districts. House Bill 174 is a bill that we had lots of support for. It's something that we have advocated for several years, and it would extend Medicaid coverage postpartum for 12 months instead of ending it for pregnant women 6 weeks after they give birth to their child. We do think that it will get passed. It's beginning to look a little bit like what we call a Christmas tree, meaning a lot of bills have been filed as amendments to it, and then it's been filed as an amendment to another bill. I think the sense of the legislature is that they do want to do this, but it just has gotten kind of hung up in the back and forth thing. House Bill 373 is something that you've heard Marcy and I both talk about. It would create the funding mechanism for the 988 National Suicide Prevention and Mental Health Crisis Line. The good news is that there is money in the budget to get that line rolling when it comes out on July 17th. The bad news is that we don't have a way to make sure that it stays sustainable, and that was to put a fee on each mobile crisis phone line of 70 cents a month. So we will have to come back in the 2023 session and really work hard to get that passed to make sure that we have sustainable funding. The good news about this line in Kentucky is that it's answered locally. So each of the community mental health centers, there's 14 of them, they each have their own district, and each of them has a local call center. So if somebody calls the 988 line, they're not talking to somebody in New York or Miami or California, they're talking to somebody local who can hook them up with local services. And we think that's incredibly important. House Bill 525 is a huge victory. Again, this is something that we have advocated for. I know there are CHWs or community health workers who are regular participants in the audience on this webinar, and we've worked really hard to get Medicaid reimbursement for their services. These are people from the community whose life work is to get the training and then be able to reach out to their fellow community persons to get them connected with the services that they need, whether that's health, whether that's housing, whether that's food security, and really move forward so that people are doing everything they need to be able to do to maintain their health. Senate Bill 8 came from Senator Julie Rocky Adams from here in Louisville, and does a lot of improvements of the State Child Abuse and Neglect Prevention Board by adding additional members and increasing the reporting requirements so that we can shine a light on what's happening. Unfortunately, Kentucky is at the top of the list in terms of the percentage of kids who are abused or neglected, and we really need to keep working on that. Senate Bill 102 is still kind of out there, and we're still hoping that it's going to pass. It requires some data collection for additional school mental health professionals. That data collection was only for the school counselors, and this would add school psychologists and school social workers. We're also hoping that some additional funding was put into the budget to double the allocation so that they can hire more school mental health professionals. So those are some of the good news bills. Certainly it's not all of them, but they're ones on which we send out frequent alerts and that we feel like we had a hand in helping move along. Now we go to the bad news ones. House Bill 4 revamps the unemployment insurance system in very negative ways, particularly negative for rural communities. It reduces the number of weeks that people get unemployment insurance and ups the requirements for them to take any job that they can take, whether it's one that pays a living wage or not. It was not passed along party lines. There were a number of Republicans in both the House and the Senate, particularly those in Eastern Kentucky, which has always been a job desert, if you will, with a lack of employment opportunities that really spoke quite strongly against the bill. House Bill 7 is a real victory. We couldn't kill the bill, but we certainly moved it from a very ugly bill to a bad bill, but not with the impacts that were quite as negative. And I've got another slide where we're going to go into those details. Just want to point out that a week ago today, there was a meeting of the Senate Health and Welfare Committee, and we had over 40 people there that had come from all over Kentucky and signed up to speak. Unfortunately, Senator Alvarado, as chair of the committee, only called on the secretary of the cabinet and then two organizations, one of which was KVH, the other was Feeding Kentucky. But it was a disappointment in the democratic process. And we thank all of you who came and were prepared to speak out from your own experience or those of the people that you work with to point out how negative this was. We also had 15 or 20 people that spoke out in the House. I might note that there were no Kentuckians other than the bill sponsors who spoke in favor of House Bill 7. This was a really draconian attack on the poor. It was going to make it almost impossible for people to keep their SNAP and Medicaid benefits. And again, we'll go through the revisions. House Bill 8 is a real concern, and particularly our folks over at Kentucky Center for Economic Policy have really alerted us. This moves us from an income tax to a sales tax as our basic tax system, but it's going to have the potential to create enormous holes in our budget. I think there was some modification of it, but it still is moving in that direction. There were several bills that we were successful in killing or that died of their own weight. House Bill 21 would have prohibited mask mandates in any daycare or school. And House Bill 28, we had people like Marcy who spoke out against this bill. It would have prohibited employers from asking their employees or schools from asking their post-secondary students about their vaccination status. One of the concerns that we had, and I was prepared to speak also, was about graduate students and also nursing students probably not being able to get placements in healthcare facilities if one could not ascertain their vaccination status. So, and Marcy did a great job of putting a face on the issue around people with autoimmune disorders and people with disabilities really being at risk when one doesn't know the vaccination status of your healthcare provider or others. Unfortunately, Senate Bill 83 passed, and it would prohibit transgender athletes from participating in women's sports. The Fairness Campaign and a number of other groups, including the faith community and many people that spoke out against it from a social justice, from a mental health standpoint, really affects these youngsters who are transgender, who did a wonderful job of coming forward and telling their stories. It was really heartbreaking to see them over and over again talk about, I just want to be able to play a sport with my friends. And, you know, the detrimental effect. We join a number of other southern states that have passed these damaging bills. House Bill 739, fortunately, did not go anyplace. It would have allowed criminal and civil actions against Department for Community-Based Services, social workers, and would have made it, I think, almost impossible. And the cabinet thought almost impossible to hire social workers if you could be sued for anything you do in the course of doing your job. Senate Bill 138 was an anti-critical race theory or anti-CRT bill. to limit instructions on race, religion, to certain documents that were chosen by the bill sponsor, Senator Max Wise from Adair County or Taylor County. And we thought we had it stopped, but it got rolled into Senate Bill 1 and passed along with another anti-CRT bill that also is damaging. So those are some of the bad news bills. It's always discouraging at this point in the session to look at what damage has been done. We take pride and rejoice in the things that we were able to either slow down or stop or tremendously alter, but we still are sorry that some of these things were successful. Next, please. So House Bill 7 does these things, and we're trying to lessen the negative impact. So it keeps what we call broad-based categorical eligibility, and SNAP change reporting was not changed, which was a benefit. The cabinet will be allowed but not required to assign SNAP participants to participate in an employment and training program. They will be allowed to consider fluctuating income, not just the most recent income statement, because we know with seasonal workers, we know so many people that have jobs that are dependent on the number of hours they're assigned, or jobs, for instance, as a waiter or waitress, that their income fluctuates considerably. Probably one of the biggest wins was that the cabinet will have 12 months instead of 60 days to complete the Medicaid recertification following the end of the public health emergency. They call that the unwinding process. And they literally would have been unable to process. We're thinking that there probably are 180, 170, 180,000 Kentuckians whose status has changed in some way during the public health emergency, which we think may end in July of this year. Hospitals will not be subject to penalties when they do their Medicaid presumptive eligibility applications, which is critical. CFX, the cabinet will be required to develop a Medicaid community engagement program, but we think it can be done voluntarily. And instead of requiring a single EBT card, which would have been extremely costly, there will be studies conducted on using a single card. So, and those are not actually all of the positive changes. There still are things that we're worried about, and we're worried about the interpretation once the administration changes the next time, and we have different people in the cabinet to make interpretations of this law. But again, a huge thank you to you all for raising your voices, and for those of you who reached out to others to raise their voices. I think it really did turn the tide. Our people on the ground in Frankfurt, many of whom are going to be providing updates to you today, were able to meet face to face with legislators and say, you know, we know that you've been hearing from your people back home and from lots of organizations. I don't know what the final count was, Emily, in terms of, we had nearly 100 organizations and close to what, 150, 175 individuals who signed on to our letter.
I think by now it's over 300 individuals who have signed on.
Wow.
We had 91 organizations.
91.
And the letter is still open. We are collecting more sign-ons between now and the end of the veto period, assuming that House Bill 7 could be vetoed. That veto will very likely be overridden. And so we want to remind legislators one more time how many people are asking them not to create these additional barriers.
Yeah. So you all have really risen to the occasion. But again, if you somehow were in hibernation and didn't get that letter to sign on to, please do it. If you've thought of some other community groups or people that you haven't circulated it to, and Kelly's just put the link in the chat, thank you. And then I have one more slide that is kind of forward looking. And that's about reminding you that this is an important election year. So ostensibly all 100 Kentucky House seats and half of the 38 Kentucky Senate seats will be on the ballot. Not all of them will have contested races, so they may not all be on. But the primary election is just around the corner and the registration deadline is April 18th. So again, really close. If you have moved, if you have changed your name, if anything's changed, if you forgot to register last time around, go to your county clerk's website and get registered. Also, your district likely change, particularly if you're in a Senate district, and particularly if you live on either the far east or the far western part of the state, because the population has moved away from the outside borders and toward the middle, toward the more urban areas. I know I was doing a workshop on Saturday and somebody said that their Senate district, they lived out in Floyd County in Eastern Kentucky, that their Senate district had changed dramatically and they had a different senator representing them now. So you can go to the legislature website and where it says, who's my legislator, put in your home address and a little box will come up and it'll show who your representative and senator used to be. It'll be listed as 2013, and then it will show who your new senator and representative are. It'll be listed as 2022. I will tell you that many of the legislators who now have new districts are very nervous because they don't know the people in those districts. So you really have an opportunity to reach out to them with my famous, send your email and put in your subject line, I am your constituent. I would be tempted to say, I am your new constituent, and really get to know them right off the bat. You can also go to the Secretary of State website to see the candidate filings, and we'll be getting those out to you as well. I would really encourage you to get active in those local races. I will tell you that you will have a friend forever in a candidate or in an incumbent who wants to get reelected if you're willing to walk the district with them, to hand out materials, to fill out postcards, to throw a little money at them because it's expensive to campaign. All of those postcards and those yard signs and so forth cost money. And we want to be sure that our legislators are not just the rich and wealthy, but the working folks that may need your help in all kinds of ways. And remember that elections have consequences. We learned that both on the good side and on the not so good side in the last couple of election cycles. So get registered and be sure to vote. And again, my thanks to you all for your advocacy. You've been outstanding. And I will turn it over to Dustin. Thank you.
Sounds good. So I've got a two-parter today. I'm going to start by talking about where the budget has ended up, which is pretty close to where it's going to end up. And then we'll get into our normal economic sort of conditions update. So I'm going to start by dropping a link in the chat to our analysis. My role at the Kentucky Center for Economic Policy is as our sort of economic security analyst. So I work on a lot of the programs we talk about here. I am not sort of the tax and budget guy. So I'm sort of playing one on TV today, I guess. But having said that, I will just run through a few of the highlights from where the budget ended up, just in terms of things that I think folks may be interested in. The first thing I want to say is just a reminder, and I say this every time we talk about the budget. A budget, may sound technical or like a spreadsheet or whatever else, but it's really a statement of what we value. And if we look at our budget as it's currently configured, most of our funding goes toward education and healthcare. A large chunk also goes toward the criminal justice system. And the rest of it basically goes toward human services and everything else.
Okay, I think I hurt myself. Uh-oh, well, that ain't no good.
Oh no.
Oh no, somebody.
I'm sorry, somebody fell and hurt themselves. So I'm really going to focus today mostly on education and Medicaid, but one thing that I want to point out is that while these categories do increase in terms of just the raw number of dollars that are going into them, once inflation is taken into account and once you compare it to the growth of the economy, it is shrinking. We have less and less money to be able to provide the things that we care about each year. And so agencies and different interests end up fighting for larger pieces of the shrinking pie. Now, this year, that was different because of a large amount of federal aid. We ended up with really unheard of surpluses. I would say once in a generation, but that's probably not rare enough to describe how large these surpluses were. And somewhere around $3.4 billion across a couple of years. So this was a really huge opportunity for us to be able to make some significant investments, make up for some ground that had been lost over the last decade through underinvestment and through an erosion of our general revenue, our general fund revenue, because of tax cuts that have taken place in the last several years. So the big question was, will we take advantage of this? So let's go ahead and get into that now. If you want to go to the next slide. So the first thing, and again, the largest single appropriation that we make every year is in P through 12 education. And the majority of that is through what we call the SEEK formula, which is our core way of funding, our education system. So if you look at that graph on the left-hand side, the dark blue bar is what the state puts in, and the light blue bar is what your local districts put in. And so you'll notice that that dark blue bar has been dropping almost every single year since the Great Recession. And these years were no different. If you look at the 2023 and 2024 years, it has continued to fall. And we are now about 27% below where we were in 2008. At the same time, that's really forcing local governments to pick up the tab on that, and it's putting pressure on them. But local school districts only have basically so much room to be able to tax their districts to make up for that shortfall. And so what we're seeing is an increasingly smaller amount of money that is available to educating our kids, which is something that's really important. Not only to make sure that they're prepared for, a job market and prepared to be good citizens, but we also know that education and health are inextricably linked, and that people who are better educated have better well-being throughout their life. So this erosion in funding, I worry, is creating an erosion in well-being over the course of these kids' lives. And the other thing is that that's not evenly distributed. Poorer districts who have a harder time making up that decline in state funding are doing worse than the richer districts who have a much better property tax base. So many folks will remember that 30 years ago there was a Supreme Court ruling that said that the state was not living up to its constitutional mandate to provide an efficient system of education across the state, and so the state passed the Kentucky Education Reform Act, and it really closed that gap almost entirely within a couple of years. And we are now actually approaching the level of inequity between rich and poor school districts that we saw before KARA. And so that is a deep concern, I think, that we just are not hearing a lot about in Frankfurt. So let's go to the next slide. Another aspect of education funding is school transportation. And while that may not sound like that big of a deal, this is hundreds of millions of dollars. And the state is statutorily required to pay 100% of that. But we, as you can see from this chart, have been gradually slipping, which again is putting more pressure on local districts. And this is outside of that SEEK formula. So in addition to having to make up a decline in core funding, school districts are also having to find more money to be able to pay for school buses. Now, this year, we're moving in the right direction. It's going to go from about 55% to 70% funded, which frees up, as Dr. Schuster was mentioning earlier, it frees up a little bit of money for districts to now be able to use on the things that they're supposed to be spending local dollars on. But it's still not far enough. So let's move to the next slide. So outside of the SEEK formula, the second single largest state appropriation is Medicaid. While I've heard recently that, Medicaid is a huge cost. That is true, but I think that it's probably disingenuous to think of it as just a cost. It's really an investment in the well-being of Kentuckians from before birth all the way through to end of life. Half of all births are covered by Medicaid. 70% of nursing home bills are covered by Medicaid. A third of the state is covered by Medicaid. And that means that those folks are able to get the medicine that they need, get treatment that they need, recover from accidents, illnesses, addictions. It is an incredible tool that we use to improve the lives of 1.6 million of our neighbors and loved ones. And the upcoming year is no different. So in the next couple of years, traditional and expanded Medicaid costs are being fully funded. We don't anticipate needing to restrict eligibility or anything like that. We have the money to be able to bring people on when they need it. The state anticipates that there'll be an initial dip in enrollment in 2023, followed by a small increase in 2024. Now, while it is true that we've fully funded it, we don't anticipate having to create new restrictions. There are, as people know on here, special programs for folks with disabilities. Particularly, I want to highlight Michelle P. and SCL, as those are the two types of services with long wait lists. Last I saw, I think it was last August, there were over 10,000 people on those wait lists. And yet this year, the legislature is only going to increase the number of available spots by 100 per program over the course of 2 years. So 50 in the first year for Michelle P, 50 for SCL the first year, and then another 50 for each program the year after that. That's a drop in the bucket. That's really not enough to be able to provide the services that folks need to be able to, stay in their homes and receive care outside of an institution and move on. There's a question in the chat about what is Michelle P and SCL. Those are great questions. Those are services for people with intellectual and developmental disabilities so that they can remain in the community rather than going into assisted living or a nursing facility or some other kind of institution. It provides, SCL in particular provides residential care like small home settings rather than, a large institution. And we can get more into that later, but that's my down and dirty definition of those programs. That's a great question. The other question out there is that the legislature has directed the cabinet to create a new set of services in the community for people with severe mental illness. The question is, what kind of waiver will that be? And I won't get into a whole lot of details, but we're hoping that that type of waiver looks more like what Michelle P and SCL look like, rather than a different type of waiver, which would maybe not be as permanent and not provide the kind of services that we're hoping for. All right, so let's move on to the next slide. So the other thing, and actually I think the one real shining star in the budget is that the legislature is going to provide really substantially large raises compared to the past for really the first time in about 14 years. State workers have seen their wages drop by about 4% in real dollar terms over that time, while private sector wages have gone up about 13%. And so this is trying to undo some of the harm that's caused, because low wages and no longer having a traditional defined benefit pension plan has led to massive shortages throughout the executive branch, including the Cabinet for Health and Family Services, which have about 1,700 fewer employees now than they did 10 years ago. So the way that they're doing it, the first year, they're giving a 8% across the board raise to all state workers. Some folks are going to get a little extra on top of that, in recognizing that they have been stagnant for even longer, that their wages are artificially low, and that there's a large amount of turnover and quits in those positions. Specifically, many frontline staff, including caseworkers and social workers in the Cabinet for Health and Family Services, they'll get $2,400 and then 8% on top of that. So the 8% will include that added $2,400. Public defenders are getting a salary schedule improvement, basically to bring them closer to parity with other lawyers within state government who tend to earn a lot more than they do. And then non-elected judicial branch employees will get $2,000 before the 8% kicks in. So that's a really, really good deal. And frankly, it gets better because the next year they have reserved enough to add another 12% increase on top of that on average, but they're going to do this in a more methodical way. So there have been issues over the last 15 years, essentially, where the ranking within state government has gotten messed up so that some supervisors are actually making less money than the people that they're supervising. And also just finding parity within positions as opposed to the private sector. There are a lot of issues with the way we compensate state workers. So they've directed the Personnel Cabinet to do a study, make recommendations, and they've set aside $200 million to be able to act on those recommendations next year, which I think is long overdue. It's a really good idea. Obviously, it depends on what the proposal is that they come up with, but I think it's heading in the right direction and hopefully cleaning up a lot of really messy situations from the past. All right, let's move on to the next slide. The other big part of this year that they needed to decide on, which we don't normally encounter, is a very large amount of federal money through the American Rescue Plan Act. That some people, you'll hear some people refer to this as state and local fiscal recovery funds. This is a $1.1 billion deposit into the state treasury from the federal government to be used on infrastructure, on making up for lost state revenues and helping mitigate COVID-19. I and others think that, and this is the second of two. So we got 1.1 billion last year, getting another 1.1 billion this year. So about 2.2 billion total. We think that there are some serious missed opportunities. Most of this money went to infrastructure projects, which is a good thing. It went to businesses through lowering their unemployment insurance taxes, which is probably unnecessary. And then it went to a lot of smaller pet projects, and there's a full list here that you can see. And that list is also in the link that I provided earlier if you want to look in more detail what those are. They could have used that money for direct payments to low income folks. They could have used that money to provide hero bonuses to essential workers. And they chose not to do that, or other things that they could have used that money for. There's very little money left over in the end. Out of that $2.2 billion, there's only about 35 million left over. And they have several more years to be able to decide what to do with that. So our hope is that they set that money aside for, specifically helping folks who have been hurt the most throughout the pandemic. But that remains to be seen, and it won't be spent this year. So let's move on to the next slide. Okay, last slide on the budget before we move on to the economic update. There is a lot of money left on the table. They budgeted almost all the money, but they left $1 billion unappropriated. One of the big reasons for that is House Bill 8 that Dr. Schuster mentioned, which erodes our tax base by shifting us slowly from an income tax to a sales tax. Income tax grows much faster than sales tax does, and it is more stable than sales tax is. And we're worried that, we're headed in the direction of Kansas, where we end up with a tax base that's more volatile, that is slower to grow, and that eats away at our general fund as a percentage of the economy over time, which I think is part of the goal behind that is being able to shrink the amount of taxation over time and not taxing wealthy individuals who spend less of their income and save more of it. This is going to cost the state $888 million the first year, which will mostly benefit wealthy individuals. So the first percentage point, we have a 5% income tax rate. This would move us quickly down to 4%. That would give the top 1% of Kentuckians, who are on average millionaires, a tax cut of over $11,000. The other thing that this budget does, which is not necessarily a bad thing, is it adds another $250 million to the rainy day fund, which would give us a total rainy day fund, sometimes called the Budget Reserve Trust Fund, of $1.5 billion. That's about 12% of what we spend each year. We think that's roughly right. It's okay. We think there were probably some things that were needed this year that they could have spent that money on. But all in all, it's important to have that money ready to go for the next downturn. and to keep it there, not spend it down in future years until it is raining and we do need to use that money. So I'm going to go ahead and move out of the budget section and into the economic update. And if folks have questions about the budget, feel free to use the chat and I will try and interact and answer those as much as I can. The same goes for the next part. So the first thing I just wanted to say is that our jobs recovery is remarkable. We fell much deeper than we did during the Great Recession in terms of a lack of jobs. It was a precipitous fall. Within the first couple of months, we regained about half of those jobs. And since then, we've been regaining jobs at a faster pace than any of the last 4 recessions. I've got 3 of the past recessions here on this chart. So that yellow line is what we're currently experiencing. And it has been a recovery that's roughly twice as fast as the past 3 downturns when you look at month-over-month job growth. That is sort of a direct contradiction of a lot of the rhetoric we hear about there being a job shortage, a worker shortage, when in fact we are only about less than 1% below where we were pre-pandemic already. And we're a little over 2 years out now. So let's move on to the next slide. Related to this worker shortage, people have referred to the Great Resignation. It's not so much the Great Resignation as it is the Great Finding a Better Job. So people aren't dropping out, they're trading up. If you look at this chart on the left, these are different industries, and this is national data, but Kentucky's not that different from the national picture. The lower wage sectors are the ones sort of to the right of that chart. And they're the ones experiencing the most volatility. So the largest number of quits and the largest number of hires. But the point of this chart is to show that in every single sector, hires are outpacing quits. So folks are quitting in large numbers, but they're quitting so that they can take jobs that pay better, that have better benefits, that are a better fit for their lifestyle, whether that's through scheduling or because it's closer to home or because it's an industry that they're more interested in or a position that they're more interested in. And that is a good thing. I mean, this is what economic mobility looks like when it's moving in the right direction. And I think we should really, instead of seeing now hiring signs and sort of hand wringing, we should look at that as a really good thing, a really positive step for the economy that folks are hiring and folks are filling those positions and they're doing it quickly. And again, I just want to reiterate that the sectors that are experiencing the highest churn, so the highest number of quits and hires, are the same sectors that are usually the worst about scheduling. They employ practices like just-in-time scheduling, or they only give you your schedule before. They have the lowest number of benefits, and they usually pay the least. So if you want to improve how well you're hiring as an employer, pay more. So let's move on to the next slide. The data actually backs up that idea. So if you break out the number of jobs in the recovery, and this is a slide I've shown before, if you break out the jobs by yes, can you hear me?
You're breaking up a little bit for me. I'm not sure if it's happening for others, but if you turn off your video, it might help.
And I just disconnected from our, so that helps too. Is that better? Can you hear me?
I can hear you.
Oh, it's worse.
I think it's actually getting better. Maybe just start this slide over. I'll let you know if it works again.
Sounds great. So I was just saying before, about how the sectors that have the worst scheduling are experiencing the most churn and having the most hiring. That's borne out in the data when you break up the recovery by the wages paid. So if you look at this chart, it shows jobs by pay. So obviously that top line is very high pay jobs for Kentucky, over $60,000. The next line is 37 to 60. The next line down is 27,000 to 37,000. So still pretty low. It's only the jobs that are paying poverty wages less than $27,000 a year that are still yet to recover. And this was all the way back in August of last year. Unfortunately, this data hasn't been updated, but I'm sure the trend is not that dissimilar. So it's important to realize that people are returning to work. They're just not returning to jobs that don't pay well. Let's move to the next slide, and I will dare to restart my video here. The other group of folks who are not currently in the labor force in general are, first of all, retirees. So folks who are over 75 are most likely to have retired recently. Again, I don't think anyone would disagree that that's a good thing. We want people after a long career to be able to retire with economic security. And because investment returns are finally high enough that they can do that, they're leaving and they're enjoying a retirement that they've justly earned. The other group of folks, though, that you'll hear a lot about are folks between 24 and 55 years old. These are sometimes called prime age workers. I'm sorry, 25 and 54 years old. I always mix those up. They actually in Kentucky do have a very high rate of participation. So 4 out of 5 of them are in the workforce. But when you break it out by parental status, so specifically fathers and mothers, which is what this chart is about, fathers have a workforce participation rate of close to 95%. So, again, 19 out of 20 fathers, including fathers of young children, are working. It's mothers specifically, and mothers of young children, even more so, who are not in the workforce. And again, that has a lot to do with the fact that half of Kentucky is a childcare desert, where there are more kids than available childcare spots. And so moms are at home either by choice, which is fine, or because they can't find either available or affordable childcare. And that is something that I think if folks really wanted to ramp up and even an already remarkable recovery, that's something they would focus on. We also know that there's a lot of folks out of the workforce who are caring for disabled and elderly loved ones. So more home and community-based care would be really helpful in freeing up those folks. And then finally, like I said before, we know that if you raise wages, folks will take those jobs because that's what's happening throughout the economy in Kentucky and nationally. So one thing that we were very hopeful about and early data suggests was really helpful in providing opportunities for families, and particularly families with young children, was the child tax credit. So let's move on to the next slide. Although the monthly payments for the child tax credit are over, folks are still owed half of that tax credit. So the federal government only paid out half of it in monthly installments. The other half of a very large tax credit, again, $3,600 for kids under 5, kids 5 and under, and then $3,000 for kids 6 to 17. That is owed to families across the Commonwealth, and we really hope and encourage folks to fill out their federal tax returns so that they can claim that money and use it for the things that they need. This benefit has really helped just under 1 million kids in Kentucky, and we believe it's cut child poverty by about 49%. Another tax credit that's available to workers without children for the first time and also increased modestly is the earned income tax credit. Again, this is available to couples and individuals who have some earnings, and that money is meant, again, to be a support as they continue their career. Move on to the next slide. This is my final slide before I hand it off. Just want to say that there are resources available to folks who need help preparing their tax returns or who are low income and can't afford a tax prep service. I'm not going to go through all these, but just know that sort of a buyer beware message. There are a lot of companies out there who are less than honest, but the IRS does have several links to places that they have worked with to be able to provide assistance and free filing services for low-income folks. And I encourage folks to avail themselves to those. So I will stop there and hand it off to our next presenter.
Thank you, sir. This is Tyler Offerman with the Kentucky Equal Justice Center. Gonna take a short tour with us about some of the feeding programs. We've got a real, the good, bad, and the ugly here. As far as the ugly that was moved to bad, Sheila did a great job of touching base on House Bill 7. We, in coming months, I think we'll do more reports out to this group on implementation of that bill. There were actually some good parts in it, but also watchdogging the bad. So I won't talk about those, and Sheila did an amazing job going over them. But just real quick, touching base, where are we at as far as SNAP participation? We are just a little bit south of 550,000 participants on SNAP here in Kentucky. You can see here from the line graph that there's been a lot of fluctuation. You can see, early on in the pandemic where the number really shot up, sort of plateaued, and then went down as we moved into an economic recovery. The number has started to tick back up a little bit. And I know that matches with what I've heard from several food banks and pantries from across the state, seeing 25–50% increases in folks seeking food assistance. So I think the combination of some of the tornadoes, natural disasters, along with, and Dustin did a great job of talking about the big numbers on the economic recovery, but in some counties, they still have persistently high unemployment and are really struggling with getting nutritious food. So SNAP is important, we need to maintain it, and that's why stopping House Bill 7 was so important. So next slide. So talking about more bad, besides House Bill 7, another thing that the Kentucky General Assembly did this year was end the state's state of emergency. And this might be confusing to you. It's confusing to all of us because the same General Assembly voted to extend that state of emergency in January until April. They then came back in March and said, we change our minds, and ended the state of emergency early. I know we advocates, folks within the state agencies, clearly conveyed to the General Assembly that doing so would end the SNAP emergency allotments, since we need both the federal and the states of emergency. And they did it anyways. So, these things are very unfortunate. It was tied up in politics, people wanting to be able to say that the state of emergency was over. But the ending result is that 42% of all SNAP benefits going out to folks on the program will end. So it doesn't end your eligibility in SNAP, but it does reduce the amount of benefits you are getting because everyone was brought up to the max with those emergency allotments. So that amounts to about $50 million per month. There's some ambiguity as to how long those would have continued if the state of emergency would have continued, but probably July, maybe September. So it's very unfortunate that that happened. And April will be, this month will be the last month for emergency allotments, and then they will end starting next month. So one quick thing on that. Oh, well, yes, thank you. Here's a map just showing the impacts. So the counties that are darker obviously will be seeing a larger reduction in the emergency allotment SNAP benefits. One other thing that I just wanted to note, before May 1st, make sure, I know calling the DCBS call line is not always something that you want to have to do. Waiting on hold is not fun. But before May 1st, if you or someone in your family is on SNAP, I recommend calling the cabinet and making sure that all of your deductions are up to date. Because during the state of emergency, people haven't been, as concerned about, did I get my utility deduction? Did I get my medical expense deductions? Because everyone was getting the max benefit. But now that it's ending, the actual amount you get will once again be based back on your income, but also those deductions. So I would put a call in before the end of the month just to make sure that those are up to date. Okay, next slide. All right. right, the big news, besides the big news that we've already talked about, pandemic EBT is finally here. So folks might remember PEBT from earlier on in the pandemic. There was an extension of that program, but there was a bunch of back and forth between the state and the feds about what our plan was and the details in it. Well, that has been resolved. The plan has been approved, and you can find that online at the USDA's website, but just some top lines. So obviously, like it has always been the case, in order to be eligible, you must have a school-age child participating in free and reduced lunch who missed days at school because of the pandemic. So some important caveats: people that are not included in previous versions of PEBT, kids in daycare, 5 and under was a group that was included. They are not included this time. As before, homeschool students are not included since they wouldn't be in free and reduced lunch. Yes, my wife and I are on dueling Zoom calls, so I'm hanging out on the porch. So free background today. And this part is going to be confusing. I recommend you calling the cabinet to clarify how many benefits or how many qualifying days your child might have, because another group that is not eligible are those that are enrolled in virtual academies. And the justification is parents who intentionally enrolled their kids in a virtual academy voluntarily took their kids out of that school setting and into an equivalent but fully virtual learning setting, which is different from a remote learning day that was forced onto the family because of a school closure. So I realize for being in a, having a child, that might not be a clear distinction. So we'll have the number I just urge you to call, but folks who are voluntarily in a virtual academy will not be included. And then anyone who graduates in 2020. All right, as far as the timeline, amounts will vary, obviously based on you, your child, your school. And in order to kind of hit the threshold, there have to be 5 consecutive days of uninterrupted school closure due to COVID. And the dates that benefits will be going out, first tranche will be May 25th. And these benefits, if you're on SNAP, they'll go directly onto your EBT card. If you're not on SNAP, it'll go directly onto your PEBT card. And if you have never participated in PEBT before, but qualify this year, then a new card will be sent to you. We'll go over instructions for how to get a new card here in a second. But for that first, May 25th, that's going to be the majority of the benefits because of the COVID spike during the winter. Obviously, between September and February is when a lot of kids were out. The second tranche will be a month later, and those are benefits for March through May. And then in addition to that, you can see any additional benefits not yet distributed. That includes reconsideration, which I'll touch on in just a moment, will be July 25th and August 25th. There has not been, well, sorry, actually, it's on the next slide. You can go to the next slide. Reconsideration. So if you get an amount that is other than the amount you think you should have gotten, just like in previous iterations of the program, there is a reconsideration process. You can call in, the number is right there at the bottom of the slide, and say, my child was out for these weeks, I only got this much, what's the dealio? And then the cabinet will be able to do a reconsideration. They'll have to cross-check with the school, obviously, but they're just going to miss some. The school's data is not always complete, or something was lost in translation. So please do consider doing a reconsideration. And what I was going to say is there's not a firm date for when reconsiderations have to stop, but I would, probably try to get that taken care of before the next school year starts. in August, just to be safe. And then lastly, if you need a replacement card, you can call that other number directly from the card manufacturer. So real quick, sorry, I just wanted to double check the slide or the chat. Nope, just bird content. Great. Well, if you have any other questions, drop them into the chat and I'd be happy to answer.
Birds are pretty good for mental health, so I'll take it. What a great segue to make. And so is food, of course, right? Everyone, we all need to eat. Thanks, Tyler, for this. Behavioral health updates. Go ahead and get to the next slide, Kelly. I'll try to make things fairly quick. Since Sheila already covered a lot of the 988 issues, 988 is still happening in July, y'all. We are still going to have a phone number. We are still going to have people answer the phone. But House Bill 373, the whole thing with the fees, that's going to have to come back in 2023. So if you have a passion for ensuring that this stays something that is answered locally in Kentucky and that suicide prevention stuff stays on the ground here, I'd love to talk to you. I think that's it for that slide. May is Mental Health Month, and I am going to be perpetually distracted in April because of it. It's a very big month for us. What is mental health, though? Like, what do I even stand for, right? Like, what is mental health? We actually have a great sheet on that already available. Our toolkit is out. It is nationally approved already. We're going to have our logo and contact information on the bottom of it by the end of the month, but we already got the national information up. How on earth do you take care of your mental health? Where do you even start? That is where we went back to basics this year. So it's a great toolkit. Feel free to steal, borrow, whatever you want to say for all of it. There are social media messages that you can make your own, that you can just share. Please do incorporate this in all of your organizations. This is a mental health month toolkit that we create nationally that we want other people to abuse and use as you need to. So feel free to take pieces of it that work for you and ignore the ones that don't. But I think our topics and things are really important. We do have quite a few events coming up, including on May 3rd. We're having a luncheon in the Capitol Plaza. Would love to see all of you there. Governor Beshear is hopefully going to be there to make some remarks and proclaim us Mental Health Month. So kicking it off at a luncheon on May 3rd. So would love to have that, have you all for that. But please do click through and go back to basics, get some basic information for Mental Health Month for yourself, your employees, the people that you see and treat. Please make sure that you talk about mental health, not just in May, but all the time, right? Go ahead and next slide, please, Kelly. Mental health first aid. Many of you have reached out to me asking about mental health first aid classes. They are finally live for the rest of the year. If you need a class and you have a group that is bigger than 5 and you need a class that doesn't work on these dates don't work for you, I'll be happy to have a second class for you all. So I do have adult mental health first aid classes and youth ones coming up. Basically, mental health first aid, you think of CPR, right? We all have physical first aid, or a lot of us do, have taken those classes to get the basic skills to identify what's going on and how do I help, right? And that's what mental health first aid does. Helps you build those skills to identify and appropriately intervene in case someone in front of you is having a mental health issue. And we don't diagnose anyone, right? Just like you don't diagnose someone with, if they're bleeding and that kind of thing, you're like, they're bleeding, that's what's going on. We don't know what happened, right? But we know that with mental health, maybe they're just crying, right? What do we do with someone who's just randomly crying in front of us? Where do we start having that conversation? And are you the right person to have that conversation? Because sometimes with mental health, you're not, right? Maybe you're their boss or someone who they don't want to open up to. We go through all of that on the adult mental health first aid. And in youth, we actually help you identify some signs that are like normal teenage stuff and what's not normal teenage stuff. Because I don't know if any of y'all work with adolescents, but it's a lot, right? And I remember my own adolescence being on that little line of, is it just normal teenage emotions, or is this something we need to get seen about, right? I think a lot of teens straddle that line. We help you understand where that is and how to have an age appropriate conversation with kids ages 12 to 18. So we do have a couple of those classes coming up as well. They are free because the Department of Behavioral Health believes in this program and wants to get it through the state. So if you want to take those, happy to do that. And that link is live on both of those for the schedules when you get your slides afterwards. Next slide. And as always, I always put on our emergency lines. You'll have them that way. They're handy. You know where to find them. If you can't find them, please put some of this information in your phone. The 1-800-273-TALK will be 988. It's not yet, so keep it there. Keep the crisis text line 741-741. So many folks have told me that crisis text line is the way that they've been using, and it's really helpful. Anyone working on the transports bill, kids that have a lot of big feels, Trevor Project is working on a full toolkit for you all to help deal with those and big emotions from those kids. You can always call Trevor yourself as well, and also have them do the same. So I think that's it for us. Yep, and I will give it over to Priscilla.
Thanks, Darcy. Hi, everyone. I'm Priscilla Easterling. I'm the Outreach Coordinator for Kentucky Voices for Health, and I'll be doing the health updates. Thank you. So as Dr. Schuster mentioned earlier, so the public health emergency is in effect through April 16th. We do expect to hear that will be renewed around then, probably the week leading up to it. And we'll find out May 15th-ish around whether or not it will be extended past July. The Biden administration has promised 60 days, a 60-day notice prior to the end of PHE. So May 15th, we'll know if it'll be extended past mid-July. Once the PHE ends, Medicaid renewals will start again. There are lots of passive renewals that have been taking place now, but the most important thing to know right now is that your contact information and Connect needs to be updated. We know that a lot of people moved over the last 2 years. And so as they're sending out those notices that you might need to renew, that they might need more information from you to extend your Medicaid, you want to make sure that they're sending it to your current address. So you can update that information and Connect. If you don't know how to do that, or if you need help doing that or understanding any of that, your notices, any of that information, definitely reach out to connectors because we're here to help and we can help you update that information or help explain how to do that. And MCOs are going to begin sending out letters to members to let them know that the upcoming renewal is taking place. So be sure to look out for that in the mail and make sure that your information is updated. Next slide, please. So Medicaid and K-CHIP are always open for enrollment. So at any point throughout the year, you can go through and fill out an application on connect.ky.gov and apply for Medicaid or K-CHIP. If you are already enrolled in Medicaid and you would like to change your MCO, that can typically be done during the annual open enrollment period, which is October 15th through December 1st. Unless there's a cause, if something's going wrong with your MCO, you're not covering something, you're having problems with that, you can still change throughout the year for that reason. But again, it is always open. For the marketplace, open enrollment did close at the end of January, but special enrollment periods are available based on life changes and exceptional circumstances. So if anything in the previous 60 days, if some major life change happens, you have 60 days before or after to apply for an SEP and enroll in a plan. Outside of that, normal open enrollment begins November 1st. So you can always access SEPs, shop and compare plans on connect.ky.gov. And again, if you have any problems, any questions, you're just not sure what to do, you can always reach out to a connector and we can help walk you through the application process and answer any questions you might have. Next slide. So here are the available MCOs for 2022. This is an added benefit comparison chart. It's available at the link in the side-by-side PDF if you'd like to take a look at that a little bit closer. Next slide. And here are the available QHPs for 2022. Anthem, CareSource, Molina, WellCare are all available on Connect as well. Next slide. And I just love this slide, but I just want to reiterate that the American Rescue Plan increased those subsidies. And just last year in 2021, the increased subsidies saved Kentuckians $3 million. So if you haven't gone through the Connect before, if you haven't shopped for a plan, if your situation's changing, definitely head to Connect and take advantage of these enhanced premiums while you still have a chance. They're scheduled to end right now at the end of 2022. There could possibly be some changes, but right now we know they exist, so definitely take advantage of them while you can. Next slide. Okay, and so some of these special enrollment periods. So the special enrollment periods allow you to enroll in a shop and apply for health insurance through the marketplace outside of open enrollment. You can do this on connect.ky.gov. Gonna keep plugging that. Some of these life changes do require some verification. So they might ask for information about your income. If you say that you got married, or if you lost or moved, lost other health coverage or moved or anything like that. Some examples of these qualifying life events are, getting married, having or adopting a baby, turning 26 and losing your parents' coverage. If you lose Medicaid or K-CHIP, or you're newly qualifying for payment assistance or special discounts. These are all special enrollment periods. So you can, if you know that it's going to happen ahead of time, you have a set date, you can apply 60 days in advance. If you didn't know, something just randomly happened, then you can apply 60 days afterwards. And then that'll allow you to go in and apply for healthcare. You can apply for healthcare and enroll in a plan. And just a quick note, a failure to pay your premiums does not qualify for a special enrollment period. So if you lose your coverage, if you were enrolled through the marketplace and you didn't pay your monthly premiums, and then you lose coverage subsequently, you're not eligible for a special enrollment period. So I just want to clear that up. Next slide, please. So there's also something called an exceptional specials enrollment period. So qualify for a special enrollment period, the last ones, those are typically based on life changes. So you lose your coverage, your household size changes, you move, your eligibility for financial assistance changes, or there are enrollment or other plan errors. But for an ESE, an exceptional special enrollment period, these are reserved for circumstances where individuals had like exceptional circumstances outside of the traditional life events. So that's like being incapacitated, being affected by a natural disaster, experiencing domestic violence or abuse, experiencing spousal abandonment, or experiencing technical or system issues that prevented enrollment. So these are not those traditional life changes. That's not you moving or getting married or anything like that, but something else just coming out of the blue and affecting your ability to enroll in a plan. Next slide. How do we apply for an ESE? So residents or agents and connectors on their behalf can apply by submitting a statement to request this by email or by letter. So that statement should include your first and last names of who you want to enroll, the case number if you have it, agent connector name if you have it, the reason, just a brief statement explaining what's going on, what happened, and what prevented you from enrolling in a plan. And then if you've already picked out a plan and you know the start date that you'd like, include that as well, and then contact information so that they can follow up with you. And you can send that request by email to that email address or by mail to that mailing address. And then they'll follow up with you if they need any more information. And I believe that is it. Oh, presumptive eligibility, perennial favorite. So just a final reminder, or finally a reminder about PE. So currently Kentucky allows for 2 PE periods within a calendar year. So that's 2 coverage months, month of the application, and then the following month. You can apply for coverage anytime throughout the year, especially if you're uninsured, under 65, your income is at or below 138%. PE is managed by United currently, and there are about 2,000 to 3,000 Kentuckians that are currently covered by PE. Currently, the PE application is publicly available at the link that's listed, and that may change depending on HB7, but we'll see. And that should be it. If there are any questions, I will be in the chat. Otherwise, I'll turn it over to Adrian. Thanks so much.
Hi, everyone. It's good to be with you. Adrienne Bush, Homeless and Housing Coalition of Kentucky. Next slide. Okay, so we've done a little bit of work over the winter to dig into who is experiencing homelessness and break down some of the racial demographics. And some of you may have seen there was an article in the Lexington Herald Leader last week about how there are higher rates of homelessness among Black and Hispanic folks in Lexington when you compare it to the general population. And this is not surprising given systemic issues in the housing market, but we'd also done some work for a congressional subcommittee on who experiences homelessness overall in Kentucky. We looked at a couple of different data sources. One is from the Office of Health Data Analytics. One is from the point in time count that is done annually. And then of course, comparing it to the census. So, and what we have found, of course, is that especially if you look at point in time count data, that nearly 1 in 4 of the folks experiencing homelessness in Kentucky is a Black Kentuckian. And we know that that is disproportionate compared to our overall racial demographics according to the census. Next slide. Okay. So rental assistance is a key way to help people from becoming homeless. We do unfortunately have bad news to share right now. As of March 31st, the Louisville Emergency Rental Assistance Program has been closed to new applications because they have obligated and committed all of their initial grant from the federal government, as well as some of the re-granted money that came from the Commonwealth of Kentucky. If you are in Fayette County or have folks in Fayette County, you can still go to that link, the lexingtonky.gov. Of course, the rest of Kentucky is still at the Healthy at Home Eviction Relief Fund. Next slide. Okay, and so as of February, we had good numbers from Kentucky Housing Corporation in terms of how much was being spent and kind of what the high months were. You can see the peak was October. I do, as of midday today, have the March numbers. And I think what is important to share with you all is that we anticipate that the state will finish obligating its money through June. Like is in June, 2 months from now. That will be Emergency Rental Assistance 1.0. The state still has its Emergency Rental Assistance 2.0 that it will begin using at that point. Next slide. Okay. And then last month, we did share with folks that the Housing Assistance Fund has been opened. And so that's just a screenshot of that website. Next slide. It is at protectmykyhome.org. Overall, the state is getting $85 million to help homeowners who are behind on their mortgage. This is statewide. So folks in Louisville will still can apply to this fund. There are no separate funds for Lexington, Louisville, and then the rest of the state. Qualifying homeowners can receive up to $35,000 in assistance with delinquent mortgage bills, utility payments, insurance premiums, taxes, and homeowners association fees. And this is for somebody's primary residence. Next slide. Okay, so we have a couple of housing calls to action. I'm going to move right to left to really freak everyone out. One is our state call to action. We have a bill for people experiencing homelessness that would streamline the process, and that is House Bill 197. And it is almost a final passage. When the legislature comes back next week, they have 2 more days, as Sheila talked about. This bill has had its 2 readings in the Senate, so it just needs to have an explanation and a vote in committee, in the Transportation Committee to be exact, and then it can be passed on the Senate floor and sent on to the governor's office. So anyway, you should call the legislative hotline and express your support for that. Okay, and on the left-hand side, as you know, we are dealing with federal appropriations at federal level. It's pretty much a year-round thing now. And so there is a sign-on letter requesting that folks, that Congress fund housing and community development money as to the highest level possible. And then number two, include some of the funding priorities we've discussed that have been discussed in the letter. And then the last thing that I wanted to say real quick is that while May is Mental Health Month, April is Fair Housing Month. And we think people should practice fair housing year round, 365 days a year to be precise. But just be on the lookout. Fair housing is something that impacts all of us in one way or another, in terms of our choice of where we want to live and our communities. And so stay tuned. We'll have more information, be sharing more about that. And with that, I'm going to turn it back to Emily.
Great, thank you, Adrienne, and to all of our fantastic presenters. No, we are almost out of time, so I just want to remind you that we have resources for advocates and consumers at the end of our slide deck. These are always here. We try to update them and make sure we don't have anything that's out of date, but this is an area where you can go just to get some quick links and resources. And so I'll just click through them quickly. And here you can see too the dates for our other monthly webinars and our forums with the Cabinet for Health and Family Services. So please save those dates and be sure to register whenever we put out our links and our agendas on a monthly basis. We should be having the link for next month's out tomorrow in our email, along with the recording from today's webinar, the slide deck, and any resources that we shared, the chat as well. And I wanted to just remind everyone that we have these CEUs available for licensed social workers and certified community health workers. You can email Kelly if you're interested. Thank you again to our sponsors for making that possible. And we are always available. Our emails are right here, and our social media handles, websites. If you would like more information, please just reach out and get in touch. Hope to see you all next month, and please take the evaluation that's in the email. Let us know what topics you're most interested in, what information is helpful, what's not so helpful, and we'll try to take that into account as we prepare our future presentations for y'all. So thanks again and have a great day. Bye.